Good day friends, today I am going to demonstrate to you unilateral hydronephrosis in the kidney of a fetus around 32 weeks of pregnancy. This is the axial scan of the abdomen of the fetus. I try to show you that this is the gallbladder. If you see, this is the gallbladder, this is the portal vein, and I try to focus the heart. This is the stomach. You can see the stomach on the left side, and this is the heart again. You have defined that this is the left side and this is the right side of the baby. And now if you see carefully, this is the kidney, and the kidney is showing marked renal dilatation, marked pelvic dilatation, and the whole kidney seems to have been dilated. The other kidney, if I try to look at the other kidney, this is the other kidney, and if I carefully show you the other kidney, this is the other kidney. The other kidney does not seem to be that dilated. It does not seem to have any dilatation on the left and on the left hand side. The right kidney is markedly dilated. You see the other kidney now is partly occupied by the shadow of the spine because the position. This is now it is better seen. The kidney is better seen here. And if I freeze this section, I try to measure the AP diameter. This is the AP diameter of the kidney, and it is 14.8 on this side, and it is how much? It is 6.6 on the left hand side. So there is unilateral hydronephrosis. You see, this is the kidney outline. I try to show you this is the kidney outline, and this is the kidney outline on this left on the right hand side. And if I put color into this, you can see some color being taken up by the right kidney. The left kidney is not taking much color. I decrease the color gain. Colors, it appears that the renal vessels are being seen. Now I am going to turn my probe to the perpendicular direction. I try to make a coronal section of the fetus. This is the coronal section. I turn my probe. This is the kidney. You can see the kidney in the coronal section. This is the kidney in the coronal section, and the whole renal pelvis seems to be dilated and filled with the fluid. And if I try to show you, this is the spine. On the one side of the spine you see the kidney, and I try to put color, and you can see that the central is the aorta, and on two sides are the two kidneys. This may be one kidney, not very well seen, slightly hypoechoic also. This is not the renal vessel. This is the iliac artery probably, and this is the kidney. I try to make a view. This is the right kidney. This is the right kidney, and this is the whole renal pelvis being seen so clearly. And you can see that this is the renal vessel. This is the renal vessel supplying the kidney. I am trying to focus. This is the renal artery on the opposite side. I try to focus This is the kidney now on the left side. This is the kidney slightly hyperechoic, and this is the kidney on the right hand side and dilated renal pelvis. But whatever hyperechogenicity and this is the renal vessel, and the renal vessel down below here is also seen occasionally. This is most probably the kidney. The baby is moved slightly. And this is most probably the kidney. And now once we have seen the kidney, this is the kidney. This is the kidney most probably, which is slightly hyperechoic. But because the bladder is full, now I try to show you the bladder. Because the bladder is full, it means that at least one of the kidneys is functioning well. And try to see the bladder. Try to show you the bladder. This is the right kidney, and this is the left kidney. Left kidney is this is the left kidney. This is beautifully seen left kidney here. This is the left kidney. I try to put color. This is the renal vessel. You can see the renal vessel on the left side as well as the right side. And now once this is the bladder. You can see the urinary bladder, the fetus. This is the fetal urinary bladder, and the cause of the unilateral hydronephrosis in the fetus is either the vesicourethral reflex or the PUJ obstruction, which is beyond to know what is the cause is beyond the scope of this scan. And if you see that there is any keyhole appearance over here, it might look like it might be indicative of the proximal urethral obstruction, like posterior urethral walls or some other pathology. But because it is unilateral, so the pathology has to be there. I'm trying to show you the maybe that this is the this is the I don't know whether if it is I'm dealing. This is the ureter, the dilated ureter. If I can follow it up, or it is the intestine, difficult to say, but there is some structure which is slightly dilated and connecting with the, most probably it is the ureter which is dilated and going up to the, try to follow it, and I don't know whether if I can follow it up to the kidney. This structure is nearly this structure is nearly going up to the, I cannot demonstrate a connection here, but if either it is the bowel or it is the this way we have been able to demonstrate that there is unilateral hydronephrosis in the kidney, and if I measure the kidney, you would see that the kidney measurement is pretty big in size. This is the kidney from here to here, 51.9 mm and 28 mm. If we are seeing that the kidneys are at problem, we should always try to look for the liquor, and if I show you that the liquor pockets are well seen, this is a good liquor pocket here. This is a good liquor pocket here, and liquor is well seen over here also, and liquor is seen here also. Apparently the liquor is there. It may not be, this pocket is big enough for the liquor, and liquor seems to be reasonably adequate. There is no oligohydramnios for this gestational age. So the liquor is normal, the bladder is well seen, and if you want to see whether the bladder empties within 20-30 minutes or not, it should normally empty in 30 minutes, and if there is no proximal urethral obstruction. But as the baby has advanced to this gestation, it is quite unlikely that there is proximal urethral obstruction. It is the most likely cause is the vesico-urethral reflex or PUJ obstruction. But if we can see that the ureter is dilated, the proximal ureter is, if we find that the proximal ureter is dilated as we are seeing here, it is likely to be, it is unlikely that we are dealing with a case of PUJ obstruction. Then it has to be vesico-urethral reflex only. Thank you.